I used to call every lingering cough bronchitis until my supervising physician checked me on it. Your P-Pal here. Welcome to another lesson from the track. Alright, so today's segment is lingering cough, a simple approach. So this is another very common complaint. You know, the patients come in there and they've been coughing for 4, 5, 6, 8 weeks, okay? So yeah, I mean, when I first started, I would just kind of like throw it in the, okay, this bronchitis, which we all know is viral, which we all know just kind of lingers for weeks. And so I would just tell them that, because a lot of times, you know, it's like after they've had the flu, it's like, oh, the cough just doesn't go away, or after they've had COVID. So yeah, you'll kind of get this reactive inflammatory cough that does linger. And of course, you know, when they come in, it's been going on for 3 to 4 weeks at that point. And so it's hard to just calm all that inflammation down, okay? So again, I had one of my monthly required meetings where we have to do chart reviews and things like that. And so it was brought up, and then that's when the breakdown actually occurred. And so, you know, some of the stuff have to do with billing and things like that, but also how you think about it. So that's what I want to talk about today. So here's the breakdown of the 3 phases of a cough, all right? So if it's 3 weeks or less, that's when you can say acute bronchitis, all right? And we all know all of these are viral, okay? So no matter which stage, it doesn't necessarily automatically put it in a bacterial category, all right? So 1 to 3 is acute bronchitis, and then from 3 to 8, we call it a subacute cough, okay? So again, usually more inflammation, typically viral. And then anything 8 weeks or above goes into the chronic cough phase, all right? So again, there's codes for all 3 of these things. So my first conference I went to when I was about a year out, it was in Vegas, and there's this top pulmonologist there. And this guy was awesome. Like he was great because he said so many things that I think we think and we kind of just go through, but he just broke it all down, and he made things very simple. But he was talking about, for one, the different settings where like the most antibiotics are given, and like he had these charts, and of course urgent care was there. And so he wasn't just like calling us out, it was just like, he was like, well, y'all have to deal with all the crazies. Like he literally said it, he's like, yeah, that's where all the crazy people go. He's like, so a lot of times you're just like throwing antibiotics in their face just so they can get out of there, right? And I was laughing on the inside because I'm like, that is so true, right? But then he was just breaking it down. He was like, well, you know, in the patient's mind, they think it's this. And then he was like, not just how they think, but he was like, what we used to do back in the day. And he was like, you know, a lot of like elderly patients, you know, they come in and they just want like a shot or something, and they'll ask for it, because he was like, back in the day, he's like, yeah, we used to give penicillin shots for everything. And then he was like, you know, once those kind of went away, he was like, we would give a Z-Pack, right? And he's like, they would take it and then they would come back, and he was like, we would just give them another Z-Pack, right? So he basically said like they kind of train patients, you know, like that was the kind of treatment. And so, and again, a lot of things just kind of get passed on. And then he spoke about the duration of a cough. And so he talked about, you know, the antibiotics first. And then he was like, it doesn't matter how long it's been going on. He was like 2, 3, 5, 8 weeks. He was like, it's still viral. Like that doesn't really matter as far as like, you know, that doesn't automatically put it in the bacterial category just because it's been going on for a certain time frame. And then he talked about the color. He was like, so what? He was like, doesn't matter if it's green, if it's brown, if it's yellow, if it's white. Like that doesn't necessarily just put it in a certain category. And that's the thing, right? Because I know y'all know the patients, they love to tell you the color, and they love to say, it's green, right? They'll just, oh, I just coughed up and it was yellow. You know, it's kind of like they zoom in when they talk about the color. Because in their mind, they think, oh, that's bacterial, which we know that's not true, okay? It doesn't matter the color. So again, the duration, how long they've been coughing, the color of the sputum, and just because it's been going on for that long, we don't just give that stuff out. So he basically kind of talked about all those things and just like, right, like that was the treatment kind of back in the day, but that's not how we do things now. So how do you approach these coughs now? So of course, a lot of it could be from a post-nasal drip, right? If they're having allergies and things like that. I'm here in Austin, Texas, where we have really bad allergies, but also not just Austin, but our weather here, it like fluctuates, you know, like we don't get a winter, so nothing freezes and dies. And so some people, they have to stay on antihistamine for like, you know, 4 or 5, sometimes 6 months at a time. Sometimes year round. Like I'm one of those people that I take Zyrtec every single day year round. I've been doing that for about 6 years now because I know what that, I wouldn't say damage, but I know the lingering effects of a post-nasal drip. You know, of course, it starts and then they get a sore throat and then it gets into their chest. Not like a pneumonia where the base of the lungs, but where the bronchioles will just kind of get inflamed, okay? So again, they come in and they've been coughing for weeks. And so it's amazing how they'll be coughing for that long and then you ask, oh, so what have you been taking? Nothing. So you didn't take anything this whole time? Like you've been coughing for 5 weeks and you haven't taken anything? No, right? And then I first thought, oh, I need an antibiotic. And it's just like the thought process, you know, like that, because again, sometimes it's something that they've been given or somebody has told them, oh, you need this, right? And they'll just go up there and they'll come to you and that's the expectation, right? Or, I know some places have like a standard protocol where it's like, oh, if they've been coughing for 3 weeks or greater, just automatically get a chest x-ray. Okay, so we know that a chest x-ray is to rule out pneumonia, right? Like you don't need that for bronchitis, right? They're not short of breath. It's not unproductive some of the time. No fever, no chest pain, no nothing. It's just this cough that won't go away, right? So again, depending on how long it's been going on, for one, I'm usually always going to give them something for cough, all right? So we know brown fed is probably one of the most common cough syrups that is prescribed. That or the benzonatate, the Tessalon pearls, which we know a lot of times those don't really do anything if you ever had them. But hey, there's that small population of patients that love them. Like, oh, those were great. I'm like, oh, I got you, right? And then there's promethazine DM. So those are the 3 medicines that I typically will kind of alternate, all right? And then depending on their history or their additional symptoms, have they been wheezing? Some people will say yes. Some people, they'll just, oh yeah, I think so. And then I'll ask them, do you know what a wheeze is? And they'll say, oh no, right? Some people don't know, they'll just say it. But if there's any wheezing involved, yeah, you can throw an albuterol in there, okay? But it's not good to just throw that out there if they have not been wheezing, all right? So again, like I always say, get a good history, you know, is it worse at nighttime and things like that. So this chronic cough, this greater than 8-week one, you should start thinking about other causes. Is this just from like a post-viral inflammatory thing, or is it something else? You know, do they actually have asthma? A common thing that you'll hear is that, oh yeah, I had asthma when I was little, but it went away, which we all know. Okay, asthma is one of those things where, yes, it can affect you in childhood, and then as you kind of start to grow in teenage years, your airways get larger. Some people will think it went away, it's gone, right? It's one of those things that, it's like herpes, right? It can go away for a while and you may not see it for years and then it could just pop up on you one day. So I've heard that story so many times. Oh yeah, I had it when I was little, but it's gone, right? So again, I'll ask them any asthma history and then I'll say, did you have it when you were younger? And then they'll say, oh yeah, I used to, but it's gone now, right? So we know with asthma, it's more inflammation, All right, so if it's that long of a term, if it's greater than 8 weeks, I'm definitely gonna ask that, right? Because again, that doesn't necessarily mean it's an infection, and so they'll ask for an antibiotic, and I may give it to them just because it's been that long, but do I think it's actually bacterial? Not necessarily, because again, you look at them, they look fine, they're not struggling to breathe, oxygen is 100, so not necessarily thinking that, but hey, I feel like, all right, you've earned your right, okay? You've been coughing for 2 months. Let's just try and see if this works, okay? So asthma is one. Also, this is like a GERD situation. You know what I mean? Like, do they have something else going on? This is like a heartburn type thing. So ask more questions related to that, you know, heartburn, indigestion, those kind of things there. And then review the medications. Are they on an ACE inhibitor, right? So is this something like that? So that chronic, I would ask some more questions, okay? But any long duration, I'm probably just gonna give a chest X-ray. And that's just to kind of help them feel better, you know, for reassurance. Not necessarily like you have to, but just to kind of rule it out, okay? Because again, this causes some anxiety, this causes some stress for some patients. And so again, they come to you for help. So even with some of the things that I do, it's not necessarily like, oh, the guidelines say do this, is to help the patient feel better, okay? Hey, they got a full evaluation, they did an X-ray, you know, we tried this, they gave me an antibiotic, okay? Hopefully something in there should work, all right? So in addition to those 3 cough medicines, for that lingering cough, and they have not been wheezing and the lung exam is normal, one thing that I do recommend is like a steroid inhaler. So one of the ones I use is beclomethasone, and that one typically works great, okay? It's just kind of that long, keeping their airways open and things like that. So as far as systemic steroids, you know, depending on the situation, definitely for asthmatics for sure. But a lot of times I'll ask them, because asthmatics know. They've been dealing with this for years and they know. And I'll ask them, like, do you feel like you're to the point where you need steroids? And some will say yes and some will say no. And so yeah, so with the asthmatics, definitely ask them how often they've been using the inhaler, the albuterol. Because honestly, if they use it more than like twice a day, they probably need some additional help. Like if it's, oh yeah, I use it every 4 to 6 hours. Like every 6 hours, you shouldn't need it that much. Remember, that's a respiratory inhaler. All right. So if they're having to use it that much, I'm probably gonna put them on some prednisone. Usually about 5 days. And of course, ask, you know, how often they've been using or have they had any oral steroids recently, okay? So yeah, so basically for cough, that lingering cough, ask how long it's been going on. So 1 to 3 is acute bronchitis, 3 to 8 is subacute cough, and then greater than 8 weeks is chronic cough, all right? So you wanna get a history, ask if there's anything else that's going on, prescribe that steroid inhaler, and then for cough medications, Bromfed, Tessalon Pearls, or Promethazine DM. You know, they have the ones with codeine. I tend to typically stay away from those. Like, I don't remember the last time I actually gave somebody Cheratoxin, but that is another option there if you just have to do it. So yeah, and that's pretty much it, guys. All right, so hopefully this was helpful for you. And as always, you're in P-Pal here. Practice boldly, and I will see you on the next one.